Hello, this is Dr. Gretchen Kubacki from PCOS Wellness in California. And in May, we are celebrating National Women's Health Week, which kicks off on Mother's Day. If Mother's Day is a sore spot for you or a hot topic, definitely check out my other video blog this month, which is on the topic of Mother's Day and non-Mother's Day. But National Women's Health Week. You probably haven't even heard of it, sorry to say. I hadn't either until a few years ago, despite being a health psychologist and a woman. So anyway, what is this about? Well, it runs for a week. This year it is going to be kicking off on May 12th and run through May 18th. And it's about making yourself and your health a priority. As women, we are often responsible for so many things. Family life, our parents maybe if we're older, children sometimes, jobs of course, school, keeping a house together, carrying a lot of the emotional weight in a relationship. We have a lot going on. And unfortunately what often happens with women is that we will put our health second or third or just don't deal with it at all. So sometimes in my practice, I end up seeing women who literally have not been to the doctor for 10 years because they were, for example, responsible for elder care for their parents. And it was always going to the doctors for their parents and dealing with other crises. And then all of a sudden they're not feeling well. They get diagnosed with cancer. I'm not saying this is going to happen to you, okay? But it's one example of what does happen sometimes. Or women will get diagnosed with something like diabetes or heart disease when they hit their middle ages. And it kind of comes out of the blue because they haven't been going to the doctor regularly to check up on things, get regular lab tests, find out what their risk factors are for various diseases. So what I want to encourage you to do this week and this month and really all year for your whole life is I want you to make your health a priority. How do you do this? Number one, if you have not been to a doctor in over a year, please call right now and make an appointment. Any general practitioner, primary care provider, or internist. If you have PCOS, you should probably go see your endocrinologist or get one if you don't have them. But in any case, just the basic health checkup where they will check your blood pressure, check your blood glucose, talk to you about things like weight and smoking and alcohol, if any of those are issues or concerns for you, and hopefully give you a plan for improving things. But you probably already know what you need to do, right? You know if you're carrying an extra 20, 30 pounds, or if you've been subsisting on junk food, or if you have 2 or 3 or 4 cocktails every night, right? You know those are problems. And for God's sake, please, if you are smoking, stop smoking. It is the single worst thing you can do for yourself, I think. It's just implicated in so many diseases. So, being proactive, get yourself to the doctor. Make a couple of small changes in your diet because we could all use some improvement there. Aim for at least 5 servings of fruits and vegetables a day. That is the absolute bare minimum. Double that amount is really better. A serving is only half a cup of cooked vegetables or half a cup of fruit. That could be half of a large apple, half of a banana, a couple of plums, 15 grapes, half a cup of cooked broccoli or spinach, half a cup of peas, which are also a nice protein source, by the way, especially if you're vegetarian or vegan. Those things, as we move towards a more plant-based and whole foods kind of diet, naturally result in better health. Make sure you get your water. Look for half your body weight in ounces. So if you weigh 180 pounds, you want 90 ounces of water every day. I know that sounds like a lot, but get yourself a few water bottles, fill them up at the beginning of the day, and make sure you get through them by the end of the day. Sometimes the easiest way to do that is having about 16 ounces when you wake up, mid-morning, lunch, mid-afternoon, dinner, end of the day. That probably adds up to more than my example ounces, but you know where I'm going with that anyway. The point is, get the water in. If you don't like the taste of water, add some lemon, some cucumber, a few berries. I personally hate flavored waters, but I know that is a trick that works for a lot of people, and I love the taste of water and I drink it a lot. Limit your caffeine. Keep it down to 1 cup. She's trying to kill me. No, I'm trying to save you. Too much caffeine will jack up your blood pressure sometimes. It will contribute to anxiety. And if you're already dealing with depression or anxiety, the last thing you need is more stuff contributing to that. Similarly with the alcohol, no more than 1 drink a day. If you're prone to depression, don't drink at all, or limit it to special occasions, your birthday, Christmas, that sort of thing. You will do better for that. And also, be sure that if there's some sort of medication that you need as a maintenance medication, I'm especially thinking about blood pressure medication. And I talked about this a little bit in February, which was National Women's Heart Health Month. It is critically important. They call high blood pressure the silent killer, and indeed it is the silent killer. You are highly likely to have no symptoms of high blood pressure, but if you don't control it, it will make it much more likely that you have a stroke or a heart attack. And let me assure you, from decades of working with chronic illness patients, you don't want a stroke or a heart attack. Those are really debilitating conditions to live with the after effects of. If you have questions, please reach out to me at askdrgretchen@gmail.com, and be sure to like this video, share this video, and drop a note in the comments and tell me what it is that you'd like to see more of from Dr. Gretchen Kubacki and PCOS Wellness. Thanks for tuning in.